So welcome to this applicant webinar. Happy to see all of you. Before we start, some housekeeping announcements. We are doing this webinar style, so if you have any difficulties either hearing me or anything like that, you can contact us at this global initiatives at healtheffects.org. You can also turn on the closed captioning at the bottom of your screen. We would encourage you to use the Q&A box to post your questions. The intention for us today is to take as little time as possible just going through the introduction and what we expect of this funding call, and hopefully a lot more time on questions and answers. The recording of this we are recording this session, so we'll make this available to those who've been able to attend and those who haven't been able to attend as well. After the webinar, we'll also post the slides that I'm about to present on the website, the same link that you used to access the RFIQ document within this week. And I know most of you will probably take Easter off on Friday, so we'll try and do that by Thursday thereabouts. So I think we can begin our session today. And this is going to be our general structure. So we'll introduce a bit about HEI, talk a bit about HEI. We'll go into specifics of the request for funding, request for statements of information and qualification. That's the long abbreviation RFIQ. And we'll go into the expectations for the research proposal, and then we'll have a Q&A session. So who are we as HEI? Most of you may have had me speak about this in many of the workshops that we have attended. So we are a nonprofit, and we do provide impartial science. The impartial or independent science is a big factor in terms of how we work. And the intention for us is to inform decisions in order to foster health, the environment for all. We mostly work in the area of air pollution and health. We have 3 programs currently. Those are the Environment and Health Program, Energy Program, and the Global Initiatives Program, which is the one that has brought us here today. And we'll see how that works as well. So all this sort of deliver complementarity in terms of the solutions and insights to inform public health interventions in various regions and localities. So as I said, the impartiality is a big part of us. So we are equally funded from government and industry. We do impartial scientific research. A lot of that involves identifying sort of science and research priorities through meetings, webinar series. We do have an annual conference that happens every end of April in the US. Through that, we get to select, funding proposals, and our scientists or our staff oversee the research. We have independent oversight on that research through research committees, review committees, and our board as well. And, following that, we do engage a lot in seminars with practitioners and many others in conferences and many other places so that this science is sort of put to good use. So global initiatives is sort of where we do a bit more in terms of, this dissemination of this science. Most of you will be aware or will have seen the State of Global Air report that we do every year. So that's one of the initiatives that we have in collaboration with the Institute of Health Metrics and Evaluation. That brings you sort of high quality impartial data on the state of air pollution and health globally. We do have programs in the regions at the moment in South Asia and East Africa, where we sort of work a lot towards evidence synthesis. I'll speak a bit about the scoping review that we did as we go through this presentation. We support collaborative networks. And in the case of Africa, some of you might be familiar with the Africa Clean Air Network and its annual convening, the Clean Air Forum. So this is sort of how we do this as global initiatives. And as I said, we are currently present in East Africa, hence this call, and South Asia. And we have in the past also worked in Eastern Europe. So again, the impartiality and the oversight that is a big part of us. We do have a global initiatives oversight committee with 6 members, as you see on this diagram here. They work with us to sort of inform our strategic direction, also look at the kinds of research we are funding, including this call in particular, and advise us on, what's happening and what sort of directions we can take in terms of our activities and our rolling out our sort of activities in various regions. The link is there. These slides will be provided to you, so you can also access all this information. So on to the topic of today, which is this funding call, the expectations and that we have of the study teams that will be applying to this and the investigators. So I'll spend probably a lot more time here, just so we go through step by step in terms of how did we arrive here. So yeah, this is sort of a culmination of a lot of the work we've been doing for the past 3 years or so, since we started working in East Africa. We know air pollution is one of the leading risk factors of death in the East Africa region, as we present in various sort of convenings. The current literature on the health effects of air pollution is sort of in line with global evidence, and we found this out through the scoping review that is coming up on the screen right now. We did go through a process of kind of looking at the literature available from the beginning of when we could find these publications to 2025, and we found that a lot of studies came online in the past couple of years, and a lot of that evidence is in line with what we see at the global level. So that therefore means that we can sort of start acting on this evidence. And this is sort of what informs a lot of this information that we have in the funding call. So through this scoping review, through some of the convenings that we've had, and the picture on your far right is our initial scoping workshop held in Nairobi, March 2023. We have sort of identified these opportunities, not as HEI, but as a collective with the community at large. And this is what we've used to sort of design the topics and this request for funding that we are now talking about. So those workshop outcomes, the findings of the scoping review, a few webinars that we've done as well. I think we did one webinar series, are really key in how we have developed sort of this funding call. So what are we looking at in terms of objectives? So the idea for us is very much to sort of identify qualified research teams. And I will use the term research teams, study teams, and investigators kind of interchangeably to mean the same thing. So the recipients of this funding, in the HEI sense, we call them investigators. So who are those? What are the ideas that they're proposing? And this is really a first step in sort of identifying those ideas. We'll go through the process, as it were, in the next couple of slides. So this RFIQ will assess the scope and feasibility of the studies that will be presented to us, the qualifications of these teams, their research experience, and as an initial step sort of in the funding process. So who's sort of eligible as we get to sort of the eligibility criteria? I think that 8 countries, as it were, in the East Africa sort of community that are presented up here. The lead investigators should have institutional or primary institutional affiliation in the region. That is very key in terms of this funding. And the idea as well is to sort of promote local kind of research, locally led research, which has been also in those discussions that I mentioned in many of the convenings that we've had. We find that this is the way to go. So topics of interest, again, you will have seen this in the funding call itself, but I'll briefly go through them. So this spans all the way from exposure assessment, as you see there in the first bullet, characterizing population or individual exposure to air pollution indoors or outdoors, different sort of environments, all the way to looking at what this exposure from different sort of sectoral sources is, whether that's vehicular, whether that's domestic burning, and relating that to sort of incidences of disease or other short-term outcomes. A lot of this is, as you realize, sort of how air pollution is probably in Africa may be different from other localities. We are more or less exposed to many sources at once. So what does that do to sort of our disease incidence and reporting sort of those sort of short-term outcomes? The third one here is also something that we discussed extensively at one of our scoping workshops. So we use of existing health and surveillance data. A lot of this existing surveillance data is in the form of demographic and health survey data. We also found that I think it was maybe 14 out of 49 studies that we found in the scoping review were using demographic and health survey data. So in a way, some of this data is already available, and we are more and more seeing monitoring networks across the region. Therefore, we are gathering some form of exposure data. So linking this data that's already available with adverse health outcomes, and the list is long, as you can see: cardiovascular, respiratory, strokes, cancer, diabetes, etc. And the last one, which is also something that we do at HEI, and we call this accountability type studies. So the policies that you've put in place or the actions you've taken, depending on whether it's national level, local level, different levels of governance, how do they translate to benefits into health? And, are they effective? And what's sort of the outcome of those policy decisions over time? So this we call accountability type studies, and it's also critical in sort of how we work as HEI. So it's not simply a question of saying this is where the research is, and sort of also going into the space where actions are taken, whether that's sectoral, in transport or energy, etc. How do those then translate to public health benefits over time? So a really broad, in a sense, broad sort of topics that we're looking at, again, so that we can also sort of capture the breadth of potential research that the teams or the investigators can look at. Of course, you will sort of be applying to maybe one specifically, but that's kind of the guiding framework for this funding call to be specific. So what are the key considerations along those lines? So either the relevance and added value to the research on health effects of air pollution in East Africa will be key. In terms of pollutants, this is also discussions that we've had with many of you. There is obviously for health reasons a big focus on PM 2.5. So this RFIQ goes to that extent, but we also welcome addition of other gaseous pollutants such as nitrogen dioxide and ozone wherever possible. Where appropriate, you should sort of include statistical or analytical methods for your assessment of accuracy, precision, and bias. As we'll see in the next couple of slides, your proposal or your response to this funding call will be sort of judged on scientific merit and rigor. So including those methods and how you're going to account for precision and biases to that effect. Your work should also be clearly distinguished from ongoing work funded by other institutions. So we are kind of in a space where, as I said, for the scoping review, we did see that more than 70 to maybe 70% of the studies came online in the last 5 years, which means there's a lot of work going on, a lot of funding, possibly, sort of getting into this space of air pollution and health. So your proposed study should also sort of acknowledge that, if that is the case, but also say how it's distinguishable from already funded work so that we don't replicate what is already being done elsewhere. Multi-country analysis is particularly encouraged so that, we can sort of cover as much as possible the region and share protocols and practices that are sort of applicable across different geographies. So that's something we're keen also, the multi-country analysis. So what is the process? So we are at the first sort of bubble here, which is we put out the call. Then this gets reviewed by our oversight committee. Um, sorry. And we invite a select few to do full applications. And later on, we look at the dates for that and how the timeline looks like. So full applications come in, we have a review of that, and the review panel recommends 2 or 3 studies, as we'll see when you get to the budget, to the board for approval. And the board approves these studies, and once those studies are approved, we will reach out to those groups and sort of start contract negotiations and hopefully launch the studies January next year, thereabouts. So at this moment, we are at the initial stage where we are expecting by end of next month, 30th of April, that we'll have received the RFIQ responses. The criteria for evaluation of your RFIQ, as I mentioned before, relevance to the aims and the topics of interest that I've just gone through, scientific merit and rigor, personnel and facilities, reasonableness of the proposed budget. We are not looking at very huge budgets, so is what you're proposing sort of within a reasonable scale in terms of the budget available? And 2 maybe other things that are important to mention here. We will also be looking at the complementarity of your proposed study and the likelihood that it sort of addresses the length and breadth of the topics of interest for this RFIQ. Also important that is made to be a question for most participants. We will not consider at this stage sort of primary data collection, or if you may, funding deployment of monitoring networks as a standalone activity for reasons that this data is to some extent available. So at this stage, we may not want to go in that direction. So depending on how you structure your study, this is an important sort of consideration at the moment. A little bit more into the eligibility criteria. So if you recall, I mentioned that we have highlighted that the primary or lead applicant should have an institutional affiliation in East Africa. So in addition to that, the PI should also be sort of affiliated to an eligible organization that we'll look at later what those organizations are, or in this slide, and in a position that allows grant submission. We'll look at the past research and publication history. So maybe I may want to emphasize here that when you say past research and publication history, it's not a must that the group have published before together or worked together before. We're also looking at opportunities through this funding call to actually bring different strands of work together, whether that's in exposure and health. But past research and publication history of the lead or a PI will be one of the key elements that we are looking at. So again, access to resources that you need to complete the research. So if you're saying, for instance, you want to do A, B, C, and D, a demonstration that you actually have access to those resources needed to complete what you say you want to do. And you should have the expertise, this is a 4th slide, needed to conduct the proposed work. So if you're doing statistical analysis, maybe you may want to have a statistician on the team, a biostatistician, depending on the nature of that analysis. So if you're doing exposure, then you need to have an exposure specialist. And the last one, sort of multi-sectoral engagement, including with relevant policymakers, is sort of strongly encouraged. So that's more of a criteria that we'll sort of look at. So who are the eligible organizations? This is probably of interest to most of you. So the lead organization must be an academic or independent, a nonprofit freestanding research institution. We will also accept non-regulatory government agencies. So what do I mean by that? Non-regulatory government agencies are those that do one of 3 things, either policy implementation, research, or service delivery. So for example, I'll give an example of an institution in my home country, Kenya. So we have NEMA, which is a regulatory institution. So they would probably not qualify to be a lead organization here, but we do have research institutions, and we have many of them, the KEMRIs, the ILRIs, the KEFRIs, and all those, who are government agencies, but they are primarily tasked with doing research. So in that case, we would accept them to lead studies. Regulatory government agencies can participate, so we're not completely locking them out. So scientists from those can participate, but not lead a study. Again, if you recall, we said, the policy relevance of this research is also of importance to us. So them being involved is also critical. So we do not completely sort of lock them out. For-profit companies can participate as consultants. So that's also key. So those are the types of organizations we are looking at. And I was at a forum last week where we described sort of private sector as non-state actors. So when you say lead organizations must be academic or independent, non-profit, freestanding research institutions, you can look at it from that perspective. The budget, modest budget. So we are looking for 2 to 3 studies, 1 to 2 years in duration, budgets from 50,000 to 75,000 each. So the critical part here is the kinds of costs you're allowed to include. So that can be personnel, including the PI, students, postdocs, ETC, equipment, supplies as needed. You can include publication fees, travel fees to present the findings of this research, not any other research, at conferences. The indirect costs are capped at 30%. This is a hard one, cannot be waived. Preparation of journal manuscripts and reports, you can also include that cost in your costing for the budget. So I think that's very sort of straightforward. So we can move on to investigator commitment. So here we just like to stress a couple of things. HEI issues contracts, not grants. So at the stage where your sort of proposal has been accepted, you've done the full proposal, you've gone through all the stages, at the contract negotiation stage, we'll have a discussion on how, with the teams that are successful, on how that will be set up. But the idea for us is to make it as easy as possible for both parties in terms of getting the work that we need to do to get done, and in a timely and timely manner, more to speak. But you are expected to do a couple of other things: have biannual progress reports or webinars to ensure that you're sticking to sort of the mission of your work and maintaining high quality as possible. Present at least one poster or a couple at one of our HEI annual conference, as sort of you complete or you're near completion of your work. The changes that you propose need to be approved by the oversight committee, so that you don't, you stay true to what your original goal was for your work. And then at the end, you can prepare, and respond to review. So if you're preparing a manuscript or a report, it has to come to us for review. And so you should be sort of ready to respond to those review comments. There is a link here to what we sort of have for our generic investigator commitments. What I'll say is when you look at this, it's a bit more detailed in terms of what are the expectations for bigger funding calls. So for this one, we will adopt some of that to suit also the geography in which we are working. But what we've sort of presented here are sort of the main ones that we kind of will stick to in terms of expectations from the investigators or study teams, if you will. So the dates, which is the critical bit, and I think I'm almost through with my slides. So we have April 30th as the due date for this stage of funding call. The oversight committee will sit sometime in May and look at review the responses and select a few. So once that happens by June 10th, you should receive a response to the applicants telling you of the status of your sort of application. And then we have about 2 months or so for the invited teams to sort of do their full application. So by end of August, those come in. And then we go into a review process in the month of October. And at the same time, sort of once we are done with that in November, the funding recommendation will be made to the applicants once the board sort of approves those. And then we get into sort of contract negotiations towards the end of November. Our hope is to have studies beginning at the beginning of next year, which is January. So plus or minus a couple of weeks or months there. So this is sort of the tentative schedule that we have. At this stage, I think you hopefully have all seen the RFIQ itself, the RFIQ document. So I think this was meant just to highlight some of the things that may not have been sort of in black and white in the document. And at this stage, I would probably want to open it up for questions. I think we have done well on time. We have about half an hour. We'll invite Pallavi to maybe moderate this part of the discussion if we have any questions already through the chat or otherwise. Pallavi?
Thank you, Victor. I think that was a good overview, but also lots of information. So definitely encourage everyone to either add your questions in the Q&A function, or if you would prefer to ask it directly, you can also raise your hand and we can let you ask the question proactively. I think I'll just add maybe two things as people are thinking of any questions they might have. The RFIQ, as you'll see, is pretty open-ended, and that is because we want to capitalize on work that you may already be thinking about or doing. But as was also noted in one of the questions here, we will not consider applications responsive if the only objective is to set up a new monitoring network and generate data in a location where perhaps data has not been collected before. But if it is part of your study, one component of your study, then it is okay. So think about where data may already be available and how you can leverage it. But if you can make a case for new data generation to support your overall project objectives, that is all right. It should just not be a proposal that says we will deploy new monitors and gather data. That's what we are trying to avoid through this specific call. And then the other thing which Victor already spoke about, but I'll emphasize again, is that HAI tends to do funding a little differently from other academic or research funders that you may have worked with. So we do require more active engagement throughout the course of the project. So whoever is selected ultimately to do these studies, we will invite you to share regular progress with us. And this can be in the form of webinars, but also written reports. And at the conclusion of the project, we would like to see this work, whatever the work is, see it get published. The typical HAI process is to have a detailed investigator report, which we then publish. But since these projects are relatively smaller in terms of budget, we won't necessarily require full research reports, but we will have that progress report component during the course of the project. So, okay, I see that there's several questions coming in. So Victor, maybe I'll direct some to you. One is the possibility to apply jointly with 3 to 5 universities. Do you want to speak to that? And also, I think a related question is, can individual institutions apply? I think those are connected questions, so I'll let you speak to that.
Yeah, sure. So yeah, eligibility as long as the institutions, however many you are, fall under any of these categories. Yes, we invite as many as possible it's sort of up to you to sort of see how the budget fits into what you're proposing. Again, if you require lots of expertise, it's likely you need to collaborate. So individual organizations, yes. A collection of a consortium, if you will, of organizations, yes. As long as sort of what you're the expertise that you have in the team meets what you're proposing that you will do. And it's sort of within the budget that we have allocated. So yes to both of those questions.
Great. And then also a couple of different questions, so I'll club them. Is the call particularly to work on available secondary data? And does it support primary data generation? Does the call allow for additional health surveys to answer questions? And I think it would be helpful to maybe talk through this a little bit, Victor.
Yeah. Yeah, I mean, so I think we're not locking out completely primary data collection. So the considerations you have to make is one, the budget that you have and the time that you have, which is 1 to 2 years to complete the study. So yes, depending on what you're proposing, and I think as Pallavi said, what we do not want to do is to have a situation where you're simply just proposing, sort of monitoring networks, or even sort of gathering data on the health side as the only thing that you will want to do. I think there's other funding calls that are specific to those kinds of sort of needs. So we do kind of issue those as our sort of preferences. And yes, you can have primary data collection just as long as it's within kind of budget and sort of meets the needs of your proposal.
Great.
So yeah, I could say it's acceptable, but within sort of the conditions that I've mentioned in one of the slides. Maybe I'll go back to that one. Yeah.
Yeah, I think the way to think about this is, let's say you're proposing to look at exposures to air pollution. I'm just making up a hypothetical example. You're planning to look at exposures to air pollution in a specific community and see how that associates with a particular health outcome. And you already have some air quality data from community level monitoring, but you would like to add some specific exposure measurements so you understand either what the exposures are in a microenvironment or what the exposures might be for individuals. You are welcome to add that as a component. But if you were to submit a proposal that said, as part of this work, we will deploy 50 new monitors across 3 new cities, generate the data, and then let that data be made available, that is not going to be responsive. So hopefully that clarifies ways in which you can build primary data collection into your process, but only that generation of air quality data alone cannot be the objective. I think Dorothy has her hand up, so I'll maybe give her the floor.
Yeah, hi. Thank you so much for this webinar. It's making things clearer. I had a question because I did share this call with folks that I thought would be also interested in the region. However, I think going off like that studies that are already been done and the organizations that are doing them and being tied to an institution from the region, and some of them didn't qualify, obviously, because one, they haven't published, but they're doing this work. And so I was just curious, maybe in the future for a call like this to consider people who do this work, they've not had the kind of funding that predominantly is given to bigger institutions because of it's an institution like, for example, Makerere University Public Health. It's a big institution. So of course, I will come and give you the money. But there are other smaller institutions that haven't had that kind of funding and they've not been able to publish. And so some of the criteria already are removing that kind of group of people even before they submit, but when we already know their work is really good. So I'm just curious if in the future, some of those criteria can be revised just so you can have a bigger pool of people who are eligible, but yeah, are unfortunately not able to apply.
Thank you, Dorothy. That's helpful. And I think we're trying to make this as broad as possible, and then also trying to see where we would have some opportunities to get things going. We do also have other mechanisms which we haven't used in Africa yet, and hopefully we can in the future, which tend to focus more on, the funding is more to strengthen the technical capacity, institutional capacity. But this is a really good point, and thank you for raising it. We will definitely take this into consideration. Okay, I see another question. I mean, there's lots of questions. I'm just trying to see how we combine them together. So I think this one I'll go to first. So the sources of air pollution include extensive use of biomass fuel, and women tend to be highly exposed compared to the general population. So is it possible to propose locally specific exposure and health outcomes, Victor?
Yeah, I mean, that's exactly what we're looking for in terms of as local as possible, and sort of your interpretation of the topics of interest there would be spot on for that, as long as you're eligible and all these other criteria. So yeah.
Right. Then another question is there any specific reason that government institutions are not allowed to lead the proposal, because a lot of the data are held by these institutions? So if it will be relevant if government institutions can be eligible to be PIs. Victor, do you want to?
Yeah, I mean, so yeah, so the one thing, let me just go back to that slide. So the impartiality, as I mentioned, and sort of if I were to draw parallels with what we do elsewhere outside of Africa. So we're in the business of just providing the science, not really kind of influencing the policy. So when you say no sponsor involvement, and I'm speaking specifically about the context in the US, we have funding from EPA and the motor vehicle industry. Therefore, sort of EPA being involved in our research is already sort of not good for the impartial science that we would like to do. So it's sort of drawing parallels to that, in the sense that we kind of provide this science not as, I mean, if I were to ask the community here, NEMA has published something saying ABCD. Industry or whoever is being sort of affected by this. And we have good examples in terms of implementation of vehicle standards or industrial standards. It might be seen as being sort of one-sided, as opposed to this is what actually the science says. So from our experience, that has been the case. So that's why at this stage, it may change in future, but at this stage, we are saying we are not locking them out completely. I think that's also important to sort of specify, but they should and can be involved. They are critical piece of this kind of work. We agree with that. And just not as lead institutions. I think that's a fair way of looking at it at the moment, yes.
Yeah, and also just to add to it, I think we definitely encourage working with government institutions where that is possible and feasible, because we completely agree. A lot of times the data may be available through those institutions, but also once any research that you may undertake is completed, that is going to be the constituency that can use some of those results in their decision making. So involving them from the very early stages is really helpful, and we really value it. So we strongly encourage proposals to take that into consideration. There's another set of questions here on the research team composition. And I think what we are looking for, so the question is about whether there can be research team members from other places, or if there can be a junior researcher from East Africa and then other collaborators or senior researchers from other places, then yes. So the idea behind requiring the PIs to be based in East Africa is because we want the research to be led by people and institutions within the region, but you are welcome to compose a research team that includes individuals from outside East Africa or from anywhere in the world. That is really up to you. You can invite collaborators that you see fit for the work you're proposing, but we only require that the lead person, so how we are defining it is the principal investigator, should be at an institution which is within these 8 countries that we have included in the RFIQ. And also, if you are going with an early career researcher, a junior researcher, then in the response that you submit, please make a clear case for why they can lead this particular work that you may be proposing, because that is something that the people reviewing the applications will look at. It doesn't have to be someone who has 30 years of experience. So an early career researcher could very well lead the work. You just give us a little bit of a narrative on how the team would work, or what your principal investigator may have, how they will approach it. And Victor, I'll let you add to that as well.
Yeah, I mean, nothing much to add. So I think, yeah, it's very clear what you've said. So when you say primary institution affiliation in East Africa, we're referring to the PI. Beyond that, the constitution of the team, study team, investigators is entirely up to the team that's giving us a proposal. You'll notice we haven't specified like PhD, master's, bachelor's, whatever. So again, as Pallavi said, all we would require if you have a junior investigator leading the study is that you sort of straight to sort of describing to us how they will go about the work, the scientific sort of approach, and all those things, and making a case for why they should sort of be leading the study. So yes, we are open to having a combination of teams as long as the lead is within East Africa.
Another question here on the types of health outcomes that will be prioritized. So whether respiratory and cardiovascular endpoints are weighed differently than developmental or mental health outcomes. And the answer is no. We're not prioritizing any specific health outcomes or giving more weightage to one set of outcomes versus the other. In fact, in the scoping review, we found that a majority of the studies were looking at respiratory health outcomes, and some were looking at maternal and neonatal health outcomes. But even then, most studies were somewhat cross-sectional in nature or only looked at shorter exposures. So for the purposes of this RFIQ, no outcomes will be weighed higher than others as long as there is a good case and data available to do the analysis. We welcome novel health outcomes, and especially developmental and mental health outcomes. Neurodevelopment outcomes, they have not really been studied in detail. Even cardiovascular outcomes have not been studied in as much detail in this region. So you're welcome to propose work on any of them. Also, there aren't, okay, two other questions. Is there a limit to the number of proposals by an institution? And is the call open to individual applicants enrolled in a doctoral program? Victor, do you want to address those?
What is the first one? I had the postdoctoral.
Is there a limit to the number of proposals from an institution or an individual?
I would say at this stage, no, but obviously if the merit sort of what you're proposing is the same thing. So I would say you just stick to one proposal. You can be in one leading and you can be in another one as co-applicant or part of the research team. I don't think we have restrictions on that. Similar to postdoctoral researcher leading, we are open to that as long as they are capable of sort of having a full range of expertise to sort of do what they're proposing, and it meets sort of the eligibility criteria. So that's open, yes.
And then also, is there a specific format or a template to submit applications?
No format, no specific sort of rigorous template. We have specified, though, in the RFIQ document, the length, sort of fonts and all those things, 5 pages, and there's a list of 5 things that you need to tell us, sort of the team, who you are, what you're proposing, budgets, and all those things. So we typically, for this kind of proposals at this stage, we do not have a strict template, which is why we haven't sort of shared that as well as part of the RFIQ documentation.
Great. There is another question, which is a really good one, on preferred study designs or analytical approaches that are more likely to generate impactful findings given data limitations. As far as the RFIQ is concerned, we are not going to give priority to specific study designs or, look at certain study designs favorably versus others. Again, we're leaving this open to all of you, since you have good understanding on what is going to be feasible given the types of data that are available. But one recent publication that I will perhaps draw your attention to, and I would encourage everyone to read through it, is a commentary that was trying to identify pathways for research on air pollution and health, specifically with looking at low and middle income countries that can be helpful. And within the commentary, they talk about the different types of studies and what might be most helpful, what might be relevant. So let me see if I can share my screen for just 1 minute, and we will also share this with all of you. Again, this is not meant to be saying that a study with this design will be prioritized over another, but can give you a helpful framework on how you might want to think about what data are available and which kind of work you propose to do. So this is the hierarchy. Hopefully you can see this. This is the hierarchy of the research needs as defined by the authors. So you may, of course, disagree with some of it, but the way they were thinking about it is what can lead to generation of evidence in a local context quickly, what might require more cost and resources and infrastructure, and then trying to essentially prioritize those. So you'll see toxicology studies listed towards the bottom of this hierarchy, primarily because it requires a lot of investment, a lot of resources, and costs tend to be much higher. Whereas if you were to do collection of exposure data for specific populations, or if you were doing a time series study, you will require less data and data that may be more easily available. So I would encourage you to look at this just as you think about what study designs you might use. But we will not prioritize one over the other. We're going to look at everything in the same way. So hopefully that gives you some indication. Then also a couple of questions here, Victor, on the geographic scope. So does the study or the proposal need to look at all 8 countries, only 2 or 3? How to think about it? And then also, if there are multiple applicants in one call, is the total funding of 75,000 shared, or will they each receive that individually?
Yeah, I mean, so in terms of regional geographic scope, your study can look at anything from Ethiopia, Addis Ababa, as local as possible. So you can have 1 country, 1 city, 2 countries. And I did mention that multi-country analysis is sort of encouraged. So that's sort of a wish from our end that we see a couple of multi-country analysis. So we don't have, as long as it's in one of those 8 countries, whether it's a city, whether it's a country, whether it's a town, that's entirely up to you. The other one on whether the funding is sort of distributed equally. So if one proposal, what you're saying is you're going to fund 2 to 3 studies of total 50 to 75 each. So your proposal, if it gets accepted, and when you're doing the budget sort of estimates to us, we expect that you'll give us estimates of between 50 to 75 for that one study. So if there's 2 or 3 institutions in that call, You'll need to figure out, that's entirely up to you. We do not, so the lead applicant is the one who will probably receive this money. Beyond that, sort of how your arrangements are entirely up to you. But again, as we mentioned during the call, you need to look at sort of the expertise and what everyone is bringing to the table, but we do not dictate that beyond sort of having a budget of between 50 to 75 for each proposal. So it's not that if there's 2 universities in one proposal, they will receive 75 each for each study. The cap is at 75. So that one proposal will receive that amount.
Also a related question on will there be a consideration of geographic location? So if there's 2 to 3 proposals funded, does that mean that there will be one proposal getting funded per country, or will that not be a consideration?
Yeah, I mean, so the primary consideration, I think also as I presented, is a scientific merit and how you respond best to the topics of interest. Beyond that, obviously, we would like to see some sort of distribution in the studies, but then that comes after. I think the priority for us is to get the most, as also the objective of the RFIQ is stated, most qualified research teams in any of these countries. So it is a consideration, but it's not high on the list. As long as your methods that you're proposing are scientifically sound and you sort of meet, in broad terms, any of the topics of interest that we are suggesting at this stage, that sort of is a key consideration for us at this moment. Later on, if in case we have similar studies or we have to kind of distribute them, that's will be sort of a secondary consideration. That's precisely why I did not kind of present that outright in my slides. Yes.
Yeah, and also once we have the responses from whoever ends up submitting them, we might, depending on which ones rise to the top, we might come back to the research teams to explore if there's a better way to coordinate work that different teams are proposing, not necessarily merging them into a single project, but trying to create a more harmonized approach so that if there are 2 or 3 different studies happening, when the final body of evidence comes out, it all kind of connects. And this is again part of what we are saying in terms of HEI being an atypical funder, because we really would like to achieve maximum impact, and we are happy to help and work with the different teams to find that harmonization, but we won't say only one proposal should get funded by country. It really, scientific merit and relevance is the key criteria that we will use. I see we have 5 minutes left. So I think there's a couple of questions on the budget. One is, can we go lower than 50,000, say only 20,000, or also that the range is between 50 to 70. So does it mean some will get 50 and others will get 75? Victor, do you want to comment on this?
Yeah, I mean, so the reasonableness of the budget, I think, is something I emphasize. So if as you present your budget, think about that, what you need to get done and how it gets done and the cost of that. I mean, below 50, I don't think we have any issue with that. If what you're proposing, you're able to achieve within the budget that you're proposing. So I would say yes to those questions. Yeah.
Right. And then also I see, Dorothy, your comment about the HEI conference being in the US. And yes, painfully aware of the travel restrictions and also, perhaps hesitation for some people to even visit the country right now. So we will look at alternative options as well. Ideally, we would love to have the funded researchers come and be at the conference also as a way to network with others. But if that seems unlikely, then the Africa Clean Air Forum is the other avenue where we would really encourage the funded researchers to attend, but not worrying as much about it right now, but fully acknowledging that this is a major constraint for a lot of people. So we'll take that. We'll we won't have that as a requirement for any funded projects, because there may also be reasons that people just don't wish to travel, even if they're able to. And then a couple of really quick other questions. So somewhat related. One is, can we look at additional health surveys that can feed into the analysis? I think the answer to that would be yes, you can. In the context of what you're proposing, if this fits, then absolutely, please go for it. And then I see a question from Lynn, and also your hand is raised. So Lynn, maybe I'll just let you speak and you can quickly ask your questions.
Okay, thank you very much. We appreciate this initiative. I just wanted to find out whether you would encourage implementation science. For example, you do a survey in schools where there's already existing monitoring of air quality, and then you implement some mini interventions or some major interventions in some of the schools, and then you evaluate them to see whether the effect has been demonstrated. Would that be a good idea, or that would be outside the scope? Thank you.
Victor?
Yeah, I mean, I would say that's welcome, as long as, it's within the duration. If you can do that in 1 to 2 years, 1.5 to 2 years, we are not locking those kinds of studies out. Yes.
So would advocacy sort of, given those research results, be allowed as part of the budgeting process, or that might not be a good idea? For example,
Yeah.
when you get the results about the exposures that are very high, then you can, for example, print flyers and things like that to make sure that there is some effect, or that might not be good.
Yeah, I mean, that's
Over.
probably not something we have said yes or no to. I think it's up to the teams who are designing their projects to sort of see what's useful to do with the resources that they have. So I will say it's not a no for sure. So yes, if the team feels that that's a critical part of their research that needs to be done, and they include it in their budget, we are okay with that. Yes.
Okay, thanks. Thanks very much.
Thank you. And we are right on time. So Victor, I'll hand it back to you to conclude the session for today.
Thanks, Pallavi. So thank you all for finding time to be with us this afternoon. This is really an exciting time for us. It's a culmination of all the efforts we have had leading to this funding call, through webinar series, through workshops, through the scoping review, and many other engagements at the forum, etc. So we thank you for your time. The slides and all materials, including a recording of this session, will be made available to all of you who have registered and who may not have attended. We will, just as I finalize, we will have between now and closing of this funding call, we have we'll send a link to you with the everything, all the materials for this call. Included in that link, we are open to having one-on-one conversations. So we will have time slots starting the second week of April, second, third, and fourth, I believe, where you can book a slot with us. It will be a 30-minute slot, and we can discuss specifics for you in terms of what you're thinking, any questions you have, any issues you have that might not have been addressed during this call. Feel free to book a slot with us, and we'll sit with you. Unfortunately, we can't make it longer than half an hour, but I believe that's sufficient time for us to sort of discuss any issues that you may have. So that will be coming to all of you in the form of an email by Thursday or Friday this week, including the link for this recording and the presentation that I just made today. So feel free to sort of book time with us if you feel that anything you have as you prepare your proposal any outstanding questions that you have following this call. So in the meantime, you can reach out to myself and Pallavi through our emails that are already on the RFIQ website as well, with any questions or clarifications that you may need. So once again, thank you, and have a nice rest of the day, and hopefully we'll see you in the near future.
Thank you.